At what age should a child copy a circle, balance on one foot for 2 seconds, and speak in 4 to 5-word sentences that strangers mostly understand? 3 years, 36 months. What milestone tracking error must prompt immediate formal evaluation regardless of age? Any loss of language or social skills at any age. When should universal screening for autism spectrum disorder, ASD, occur using the MChat tool? At the 18-month and 24-month well-child visits. What is the diagnostic step for a 45-day-old infant with a fever of 38.2 degrees Celsius, 100.8 degrees Fahrenheit, but a completely normal physical exam? Full sepsis workup including blood and urine cultures, and lumbar puncture for CSF analysis. What is the first-line oral antibiotic and duration for a child with confirmed group A strep pharyngitis? Amoxicillin or penicillin V for a full 10 days to prevent acute rheumatic fever. A 14-month-old presents with a high fever for 3 days that suddenly drops, immediately followed by a maculopapular rash on the trunk. What is the diagnosis? Rosella infantum, caused by human herpes virus 6. Management is purely supportive. What is the first-line antibiotic treatment for an infant with pertussis, whooping cough? A macrolide antibiotic, preferably azithromycin. Treatment stops progression and limits transmission. A 6-month-old infant presents with episodic, severe abdominal pain, drawing legs to chest, and current jelly stools. What is the diagnosis and treatment? Intussusception. Diagnose and treat simultaneously using an air or contrast enema. A 4-week-old firstborn male infant presents with non-bilious, projectile vomiting after every feeding and an olive-shaped RUQ mass. What is the diagnosis? Hypertrophic pyloric stenosis. Diagnose via abdominal ultrasound. A 10-month-old infant presents during winter with wheezing, tachypnea, and nasal flaring. What is the most likely organism and management? Respiratory syncytial virus, RSV, bronchiolitis. Management is strictly supportive, suctioning, and hydration. Avoid albuterol. What is the first-line rescue medication protocol for a child presenting with a moderate croup flare and stridor at rest? Nebulized racemic epinephrine plus a single dose of oral or IM dexamethasone. At what age should universal screening for lead toxicity and iron deficiency anemia occur in all pediatric patients? At 12 months and again at 24 months of age. A 5-year-old child presents with gross hematuria, periorbital edema, and hypertension 2 weeks after a sore throat. What is the diagnosis? Post-streptococcal glomerulonephritis, PSGN. Confirm with low C3 complement levels and high ESO titers. A 12-year-old obese male presents with an insidious limp and vague right knee pain. Physical exam shows limited internal rotation of the hip. What is the diagnosis? Slipped capital femoral epiphysis, SCFE. Obtain bilateral hip X-rays immediately and place on non-weight-bearing status. A 3-year-old child is pulled up by the arm and now holds the elbow flexed and pronated, refusing to use it. What is the management? Nursemaid's knee/elbow, subluxation of radial head. Treat with hyperpronation or supination flexion reduction technique. No X-ray needed.